So most commonly I see patients with arthritis or wear and tear of the cartilage in the hip or knee. And what really causes the pain from that is that as the cartilage breaks down, nerve fibers in and around the joint get more excitable. You also get a lot more inflammation in the joint with that. So as time progresses, you have more pain, which leads you to be less active, which actually leads to more pain. So the cycle kind of perpetuates itself. Weight is one of the reasons that we defer patient surgery. There are very good data that having a body mass index that's too high can increase your surgical risk and can actually decrease the effectiveness of the surgery. So we work with patients, and then we work with our colleagues in the weight loss center and the bariatric surgery center to help patients who are having difficulty with weight loss achieve their goals. Very, very rarely will I suggest a surgery to someone the first time I've met them. There are activity modifications, there are over-the-counter medications, there are injections, there are a multitude of things that we can try before we even consider a surgical option, because ultimately surgery is the last line. And the same is true for a hip replacement. You have to get your strength and endurance back, and provided everything goes well, we get you up and get you moving on it right away. You're not bedbound after the surgery, really for any period of time. We want you up, we want you moving, we want you to get more active. That's the purpose of the surgery, is to get you back and get you moving again and hopefully help your quality of life long term.